Well, good morning. We are at Pine Grove Behavioral Health and Addiction Services. I got all that in?
You did.
Perfect.
Perfect.
With Dr. Christina Williams, who is the Clinical Director of Outpatient Services. How are you?
I'm very good. Thank you for having me.
Absolutely. Thanks for being with us. So we're talking, it's September and it is Suicide Prevention and Awareness Month. And so that's what we're talking about today. So let's talk about, with that in mind, what is what you do here at Pine Grove? I know that's a loaded question, but kind of give us like the high level overview.
Sure. No, we do quite a bit. So in the Outpatient Services Clinic, we treat children and adolescents and adults with a variety of mental health issues. And, you know, we try to incorporate spouses and family members and anybody that we feel like would be helpful for you, but just giving you coping strategies for any issues you might be having so that you feel like you can live the life that you're really wanting to.
Sure. In a previous segment, we talked about children and adolescents, and today we're going to focus on adults and specifically depression. That seems to be, it ranks high on the list of mental health challenges that people will experience when they're contemplating suicide. So tell us a little bit about how to recognize that in your loved one.
So, I mean, depression really has some pretty clear symptoms that you can look for. One of the things you might notice first, though, is something called anhedonia. So when you're losing interest in the things that you once really liked to do, whether that's, you know, you're a person who's very extroverted, you like to do things outside of the home, then you're starting to isolate and withdraw more. Or maybe just some hobbies that you were into that you're really not doing very often. You'll also see some changes in sleeping patterns and eating patterns and those types of things, and just a very low mood. Perhaps people are crying more often, so their threshold for crying is really low and they seem to be doing it more often. So just noticing those things in your loved one and saying, you know, this is not their norm, and I'm noticing that they might need some help.
How difficult does that conversation become with the loved one whenever you begin to notice something that might be not the usual pattern?
So I think it's really important to remember that mental health affects everyone. And including the person who's asking about that. Sure. And so maybe even admitting that, like, I really deeply care about you and I feel a little nervous to say this, but I'm noticing these things in you and I just wanted to check in and see how I can listen or how I can support and be there for you. I think there's a lot of pressure to feel like you've got to fix those issues, but oftentimes just offering a listening ear is a wonderful support and a good first step.
What do you think is I guess the clear defining moment where that person realizes, the person who's asking realizes maybe it's time to get professionals involved?
I think when you notice that their overall functioning is not at the level that that person feels like they would like it to be. It doesn't have to be extreme. You know, it doesn't have to be necessarily loss of job or loss of relationships, although if those are happening, you know, do come in and get some help, but really rather they're not feeling like themselves, or they're maybe not living out their values in the way that they want to. You know, coming in and just talking about that can give some relief and maybe getting a tool or two to get you kind of back on track. But I think that's an important question to ask. Is there somebody you can talk to about this, or someone you'd want me to call to get you some help for that? So it really can happen at any level.
And because these situations they're so personal, every single individual who goes through something like this, it's a little bit different. And so they have to be treated differently for every individual. So that's, I think, why Pine Grove really kind of is a great group to step in, because you have outpatient, you have inpatient, you have multiple layers of treatment.
We do. We actually have 5 levels of care. So depending on your needs and basically how intensive those needs might be, we can meet you where you are, and we can get you the tools and strategies that fit whatever your life needs are. So yes, we're very fortunate to have that on one campus.
And you have patients from, I heard earlier, from all over the world.
We do. Some of our programs, we are one of very few in the nation that serve that particular population or have staff that are trained in the skills needed for that. And so we have people coming from all over the world. We have all over the US. And then for our outpatient clinic, you know, we've got people who are driving an hour or two even to come and get our services. which, is wonderful.
When we were talking earlier about depression, and we were mentioning, again, it can come in many waves, I guess. And there are those who are resistant to treatment, but you offer services for that as well.
We do. And it's actually at the outpatient level of care. So, if you are in therapy, maybe you've tried some antidepressants or some medications, and you're feeling like they're just not at the effective level that you would like them to be, or your doctors are feeling that way, we do offer 2 specialized treatments for treatment-resistant depression. So we have our Spravato clinic, which is our esketamine nasal spray, and we have our transcranial magnetic stimulation, which is TMS. So those are 2 options right here in the outpatient clinic that as you're progressing in outpatient care, if you feel like you need a little bit more, we also have that here on site to give you that extra care.
What about those patients or those folks in the community who are having I guess the loved ones who are witnessing this are having a little more direct understanding of what's going on, and their loved ones are like really beginning to talk about ideas of like hurting themselves? What do you do in that? Because that's another difficult conversation to have. How do you handle that situation?
Absolutely. I think it's important to remember to remain calm. You're there with that person, and so if you kind of get elevated or anxious, then that could potentially make that other person feel nervous to share. So just doing what you need to do to stay calm in that conversation, and remember that a listening ear is the first step. So asking them how they're feeling, how long have they been feeling that way. And I think it's very important to know that asking specifically about, are you having thoughts of not wanting to be here? Are you having thoughts of hurting yourself? Those are important questions, and it's okay to ask those. I think a lot of people are afraid to say those words because they're worried they might plant that thought in there or they might push them over the edge. But research actually shows that if you do ask those specific questions, you're opening the door to that conversation that they may need to have but are too afraid to start. And so once you ask those questions, if they are having those thoughts and they say, yes, I am having those thoughts, then you can work with them to get them an extra level of care that they may need.
What do you say to that person right now that's watching that this is like they're starting to sweat, their heart starting to race, and they're starting to realize that they need to have this conversation? They're just too terrified to open their mouths about it.
Well, and I think it's a hard thing for anyone, particularly if you're not trained to work with us. Sure. And just recognizing, first of all, your heart's beating because you care very deeply about that person, which is a wonderful thing. So however you can express care and then get that person to someone trained, sure, I think gives both people support. There's also wonderful options like 988, which is the suicide crisis hotline, maybe offering to have that person make that call with you sitting nearby. Sure. So that they can get in touch, or even coming to Pine Grove. We're 24/7, so being with that person as they visit us is another way to support them if you don't feel comfortable having that conversation.
Well, if you have those questions, you have to see the number on the website at the bottom of your screen, give them a call, and they're here to help. Thanks, Dr. Williams.
Absolutely, thank you.